Hello, Tulane Admissions Office. My name is Yashesvi Sharma, and I'm from Las Vegas, Nevada, studying at W. Clark High School. I appreciate you all taking the time to review my submission for the Academic, Service, and Leadership Award. I want you to picture something for me. You're in class one day, writing your notes, and you raise your hand to ask a question or make an insight. And as soon as you begin talking, you lose your train of thought. While for the vast majority of people this is a once in a while occurrence, this unfortunately is a daily reality for those living with absence epilepsy or petit mal seizures. Petit mal means little illness in French, alluding to the mild yet interruptive quality of the condition itself.
But first, what is epilepsy? It's characterized by an excessive discharge of electrical activity in the brain, and each of these discharges is known as a seizure. There are different types of epilepsy, and each kind is different. The latest kind of classification focuses on where this electrical discharge is happening in the brain. Focal onset indicates that the discharge is in one hemisphere, generalized indicating both, and so on. Highlighted, you'll see tonic-clonic epilepsy, a generalized onset variation where seizures involve involuntary muscular movement. The type we're going to focus on today is non-motor absence epilepsy.
In this case, seizures present themselves as if someone is in a trance, like they had lost their train of thought. They can last up to 12 seconds, and during this time, the individual has no recollection of their surroundings. It's kind of like when you're watching a movie with your parents and they cover your eyes for the juicy parts. Except epilepsy doesn't give you an option to choose, it happens seemingly randomly.
Currently, the treatment plan is pretty standard across patients. Depending on how young they are, they'll start with ethosuximide, and it works in your brain tissue to control seizures. If an individual has been on ethosuximide for years since they were young, they have a 33% chance of growing out of the condition by their late adolescent age. But what about the people who don't grow out of this condition or have it onset later in life? Depending on their individual circumstances, they're given new medication. Most commonly, though, the next step is Keppra. This drug stabilizes the electrical activity in your brain by directly attaching itself to synaptic cells.
I want you to think of it like this: ethosuximide is like a pillow. The electrical activity is still there, but how it is portrayed as seizures is muffled. But Keppra, on the other hand, works directly against electrical currents to stop the excessiveness in the first place. As you can imagine, these medications have a plethora of side effects, including coordination difficulties, fatigue, increased aggression, and anxiety.
So, there has to be a better way, which is where neurofeedback comes in. This is a form of technology where an individual is hooked up to an electroencephalogram, or EEG for short, a machine that reads their brainwaves, which are then projected onto some form of visual stimulus. For a very simple example, we'll use a ball. In the case of absence epilepsy, when the EEG reading senses that the person is about to have a seizure, the ball will turn red. Upon seeing this, it's up to the individual to do everything in their power to overcome the electrical discharge and stay engaged, as absence epileptic seizures involve a form of disengagement.
At this point, you're probably thinking to yourself, how is this even possible? This is so futuristic. And you're right. Neurofeedback's been the center of a few studies, but in those few, it's shown promising success.
In one study, elite archers were tasked with muscle building memory and retention skills when it comes to maneuvering the bow and arrow. They completed 5 sessions over 30 days, one group specifically, firing 36 arrows before and after receiving neurofeedback treatment. And compared to the control, the group that used neurofeedback in their sessions showed heightened abilities of muscle retention. And in a couple other studies, we've also seen that this has helped with ADHD and PTSD symptoms.
So, what's next for neurofeedback? It's important for us to keep in mind how incredibly new this technology is. While its applications for a non invasive treatment are truly exciting, it's important to focus on how it will be implemented and who will be given access, if at all, in the future, which points to a broader conversation about healthcare accessibility, especially in an area of emerging treatment. I hope you've learned something new today, and may you never forget what you wanted to say ever again. Thank you so much for your time, and roll wave.